Hi, I am Bruna Saad. The topic of my presentation is a case report of catheter-related bloodstream infection due to Trichosporon coremiiforme in a patient with secondary neutropenia to HEV. Let us look at Trichosporon. It is a fungal, as it is known from studies that Trichosporon is a fungus commonly grow from a focal point in a parallel radiation fashion similar to that of aspergillosis and forming some structures like blastoconidia, pseudohypha, and arthroconidia. Here are some of sites of infection. For example, lungs, liver, multiple systemic infection. Let's look at another aspect of them, as most invasive trichosporonoses affect immunocompromised patients. Secondly, causing nosocomial outbreaks related to the use of medical devices as catheters and other dispositives. As you can see in the box, the people affected is especially HEV and hematological patients. Look at the picture in the right. It shows the biofilm formation and the antifungal drug trying to kill them. Biofilm contribute to systemic infection. Now, I will focus on the identify. The author of this paper brings us some problem about the correctly identification. Here they describe an invasive infection to Trichosporon coremiiforme in an HEV positive patient with neutropenia. It has merits as well as certain drawbacks. Let us consider the potential pathogen in immunocompromising patient. This strain was first erroneously identified Trichosporon asahi by phenotypic method as Vitek. Vitek is an equipment for identification of bacteria and yeasts for phenotypic methodology. It's a large used by microbiology laboratories. That is all I have to say about the identifying technique. Well, they use a conventional method as Vitek phenotypic method, as well as I told. This was erroneously identified as Trichosporon asahi by the hospital lab when the strain tested by a reference institute. They put the strain a Malthoff technique as identify Trichosporon coremiiforme. First of all, the sequence of internal transcribed spacer, the region D1 and D2 domain. The picture at the bottom on the right, you can see some equipments that I taught, Vitek and Malthoff. The chart in the middle shows a presumptive about this technique. Let us look at the pros about. The most successful gene target that has been consistently used for molecular identification of fungi is the ribosomal DNA, okay? Let's move on. So, internal spacer 1, ETS1, is the region between 18S and 5.8S gene, and ETS2, the region between the 5.8S and 28S genes. You can see on the right, ETS2, on the left, ETS1. The picture on the left shows after 3 days at 25 Celsius degree, the colonies were cream colored, dry, matte, nearly flat, odorless, and 3 mm in diameter. This character is when spread on agar and they grow up that we can see. The picture shows on the left the IFA were present, and the picture on the right mainly disarticulated into arthroconid. So this picture, these structures we can see on the microscope. IFA producer on the left and on the right arthroconid. This character is microscoped by Trichosporon. So the case: 46-year-old woman, HIV positive, was hospitalized. She has the symptoms, for example, like fever, tuberculosis history, leukopenia, thrombocytopenia, CD4 low. Some serologies tested negative for hepatitis C, B, Chagas, syphilis, IgG positive for cytomegalovirus, and toxoplasmosis, both IgM negative. And 2 tested antibodies against Histoplasma capsulatum, Aspergillus, some species like Flavus and Niger, and Cryptococcal antigen were negative. She would draw lavado bronchoalveolar as positive for tuberculosis, but she started the treatment. The fever continued and neutropenia, and blood samples were taken as CBC culture, as identified Trichosporon serri. Fluconazole empirical was started. That slide is the last I told about this misidentification, the Trichosporon serri by coremiiforme. So some characteristics, biochemistries like urease positive and Maltitov, DNA extraction, PCR of ETI's regions. They identify correctly. The sequence were submitted at the gene bank. The next test was antifungal susceptibility. Tests were carried out by determining MIC. The isolated was tested against amphotericin B, MIC. Concentration inhibitory minimum 1, fluconazole 4, itraconazole 0.064, voriconazole 0.125, posaconazole 0.25. Not to mention that was used the EUCAST document. Don't have criteria about the MIC. Resistant or sensible. To summarize, the discussion were: Trichosporon genes identification is important to define the best antifungal therapy. Micromorphological characteristics is the same. For example, urease positive. Artoconidas presence and either IFAs on the microscopy is the same. It's impossible identification like a species about these characteristics. So it's important to identify, to know about the antifungal profile and epidemiological. And not to mention conventional identification is not reliable. Convince to use the molecular methods, for example, Maltitov and PCR. Antifungal susceptibility profile for Trichosporon coremiiforme is scarce, and low frequency cases reported in worldwide. It's relevant to know about uncommon species infections and its susceptibility against antifungal drugs. Not to mention the scarce Trichosporon coremiiforme. It's not possible create the breakpoints, know the breakpoints, because the quantity is very low. The species to study and discover the breakpoints to treat. This slide I brought to show the colony in Chromatograph Candida, showing colonies that contains these characteristics. Colonies dark green in color and dry aspect. On the left, morphology after 9 days on agar at 20 Celsius degree, and color after, and we can see in the microscopy the artoconidas and pseudoiphas. These characteristics of them too. And I brought to discuss something, brought this picture to explore a little about biofilm, formed by Trichosporon 2. What is the biofilm? Biofilm is a mechanism of virulence, organized microbial or fungal communities adhere to solid surfaces and surrounded by an extracellular matrix. They can be resistant by antifungal. In this picture, we can see in the box, letter A, for example, is initiation biofilm formation. You can see letter AB, the low biofilm producer, then C and D, medium biofilm producer. Letter A and F, G and H, high biofilm producer. Especially G and H, they can be resisted by antifungal because they mature extracellular, rigid, strong. It can be very difficult, the antifungal, retrieve and kill them. So, to finish, I hope my presentation will help us with what I said at the fungal. Thank you.